In this video, we're going to be discussing the bag valve mask, how to properly assemble it and apply it to the patient. Most times when it comes in the bag, it'll come collapsed like this. All you need to do is pull on each end. It'll fully expand. And the mask should be in the bag. It'll be detached. You want to make sure that it's got a good amount of air in it so that it will create a good seal around the patient's face. And you just apply the mask to the bag valve. Make sure that it fits snug. It should have oxygen tubing already attached to it and a reservoir bag. So the first thing we want to do is attach the oxygen to the oxygen delivery device, which in this case is going to be our portable oxygen tank. And we want to set the flow rate at 15 liters. So you see that the reservoir bag here is starting to inflate, which is what we want to see. And you may see that when you deliver the bag valve mask breaths, the bag may deflate and reinflate as you give breaths. So when we come over to our patient here, you want to make sure that the pointy part of the mask is covering the patient's nose. And you want to make sure that you've got a good fit both around the nose and down on the chin. So in order to make sure that we've got a proper fit after we've seated it on the patient's face, you want to use the C and E technique. So you're forming a C with your index fingers, and you're forming an E with your middle ring and pinky finger. So what we're going to be doing is exerting downward pressure with the C, and we're going to lift up with the E. So we're going to locate the angle of the jaw, approximately with your pinky, and we want to follow the curvature of the jaw with your ring finger and your middle finger to lift up as we're pushing down. It is a little bit of a process and it does take some work, but once you have a good seal, you'll see that you'll be able to get ventilations into your patient. So for this, we want to bag a normal patient every 5 to 6 seconds, or 10 to 12 breaths per minute. If your patient is asthmatic or has COPD, you want to reduce that down to 6 or 8 breaths per minute. A general rule of thumb is if you need to breathe, your patient needs to breathe.